So Mr. and Mrs. Peets are a great example of how Spectrum Health is able to care for our aging community through all of the different stages that they encounter as they become ill and they need more care. They first encountered our system through the geriatrics clinic, and that's where they were seen. They had several inpatient hospital stays and had advanced heart disease, both of them did. And as their health declined, they could no longer come to the clinic for their appointments. So then they became great patients for our home-based primary care part of Spectrum. And in that, the clinic was taken to their home. So they still received primary care, but the doctors, the nurses, and the social workers would go to their home. And they continued that for a few months, few weeks. But their health continued to decline. And as it did, they became more appropriate for hospice care. While they were in hospice, our social worker and their primary nurse talked to them about things that they wanted to do in life. You know, hospice is for end of life. And they had made a comment that they had never taken a trip, and Mrs. Peet said that she has always thought very highly of Dolly Parton and wanted to go to Dollywood.
In talking to patients about quality of life, it's really what things are you still wanting to pursue, you know, in your life, and what things can we make happen. And there's a great organization called the Dream Foundation that I knew about, that I've used in the past with some of my other patients, but nothing to this extent, because many of our patients don't have the ability to travel anymore. Of course, you know, Forrest and Hazel are very limited right now, and so it was very touch and go of whether this was really going to work for them.
Since I've been 10 years old, I can't think of her name now. One that has a funny hat. I met her and shook hands with her when I was 10. What was her name? I can't think of her name. But anyway, we went to see Johnny Cash once, but it was so far up on the balcony that I thought I was going to have a bloody nose. And she was running around downstage trying to take pictures of it.
And the pictures never took.
Never turned out. But yeah, we, especially the bigger stars, I enjoyed. And on TV, Saturdays, we turned the TV on to watch. It's a country deal and it has country music until after 1 o'clock in the morning. And it's Larry's Diner and some of the others, and one is from Kentucky, and they have an outside one. We watch that, so we really enjoy
Minnie Pearl is the one.
Minnie Pearl is the one I met when I was 10 years old. And then that night we went to the Grand Ole Opry, and they took us in and put us down almost to the front. And then a gal come up, tapped me on the shoulder. She says, "You're going to go backstage." I go, "Wow!" So we went backstage when they had the stage closed down. They got her cookbook, and it was signed by
Dolly Parton.
Dolly Parton. I mean, and it had Hazel's name and everything written in it.
Yeah.
She wrote a note.
So you're glad you went?
Yeah,
oh, yeah.
Sure. I would miss it for the world. Yeah, that was great.
People really focusing on quality of life. It's about patients and families saying, my treatment or my illness doesn't have a treatment. But that doesn't mean that I don't have hope, that I don't have happiness. That means I'm going to stay home. I'm going to stay wherever my home may be, whether it's a facility, it's, you know, with my daughter or wherever, and I'm going to focus on the things that make me happy and that make me comfortable. And the hospice team helps them do that. So as their disease progresses, You know, they may have symptoms that are then treated by the physician, but they also listen to their spiritual needs and emotional needs. And we have music volunteers and massage therapists and pet volunteers. So they really get to know the whole patient. And they get to say, okay, this is what this whole person needs, not just the disease, not just the symptoms. And then as a team, we figure out what we can do to get them that care.